welcome to Hirehood International Academy and the webinar what we are going to conduct regarding rcsi aptitude test for nurses registration in Ireland. The objectives of the webinar will be:
first one, how to reach Ireland as a nurse.
And next we'll be discussing regarding the NMBI registration. This is the Nurses and Midwives Board of Ireland registration, how you'll have to go through it.
And next one will be aptitude test, that it will be discussed in detail.
And the fourth one will be the services which Hirehood is going to provide if you would sign in for the future trainings.
And last one, what are the benefits of joining Hirehood International Academy for this aptitude training?
So guys, please keep in mind that the medium of instruction or communication during the webinar, as expected, will be English, because there's people all over the world who is attending the webinar at the moment. And please do not interrupt in between. And you see all your mics are muted at the moment. You will be given a question and answer session where we can talk in detail about what you have the doubts, and it will be clarified.
And you can note down your doubts clarified during question and answer sessions in the last timings of this seminar.
And lastly to say, this discussion is completely oriented about aptitude test. As we keep on talking, you will have so many things coming into your mind about how you'll be coming to Ireland, what are the things to be doing about it, about Ielts, OET, about the NMBI registration, adaptation programs, so forth. Many things will come into your mind. But please guys, this is completely regarding aptitude test. If you have any other queries, you can discuss with the officials of Hirehood Academy or Hirehood International.
Sorry, before that we didn't introduce ourselves.
Oh yeah.
Actually, we forgot that. Sorry for that, guys. And it's me, Remya. I'm a nurse working in Ireland.
And myself, Janet, working in Ireland as a nurse.
So we'll continue to the PowerPoint. Yeah.
Right. First, we'll say the ways to reach Ireland as a nurse. So as you all know, you have to complete or you have to pass an English language test, either Ielts or OET. And most of them who has come into interest for this will obviously know about the scorings. So we are not going to tell all about the scorings and all that here. And the second thing is going to be the second step, which you have to go through, is the NMBI registration. And the NMBI, through the NMBI registration, you will get to know or whether you are eligible to come to Ireland or not. And that is what is called the decision letter. So the decision letter from the NMBI will tell you that, oh, come on guys, come to Ireland, we are waiting for you, or that, sorry, it's not your time this, and good luck next time, probably, So the decision letter will tell you your future.
Yeah, next one will be adaptation or aptitude test. And it will be two types of examinations are here, like adaptation and aptitude test. And here we are going to talk about aptitude test, and adaptation is a different one that we will talk, that also we will mention. And
and finally, so if you go through the adaptation and you pass through it, or if you pass the aptitude test, so then you are a nurse in Ireland and you receive your NMBI pin, which makes you to say that, yes, I'm an Ireland nurse. So that's actually, in short, how you become a nurse in Ireland. So now we'll just go through the important points, what we would like to tell you.
Next one, NMBI registrations. To get NMBI registration, as we told, there are two types of criteria are there, like adaptation program, or one, you have to undergo adaptation program or aptitude test. And what is adaptation program?
So as Ramya said, the NMBI, when issued a decision letter, it will mention either you take an adaptation program or an aptitude test. So according to your employer and your wish, you could select either of these. An adaptation program is a supervised placement in an Irish healthcare facility by NMBI. Sorry guys, there's a small spelling mistake with the health. Don't feel bad that nurses don't know the spelling of health, but it's just a typing mistake. So in where you will be sent into a hospital setting where you'll be having mentors, they'll be looking after you, they'll be supervising you, but under monitoring and supervision, you'll be providing care to the patients. And that is a 6 to 12 week program. So you have to pass through that program to get the NMBI PIN or registration. And the second one is
this aptitude test that is conducted by RCSI and it is recognized by NMBI. It contains theory and practical assessment. It is actually, it's a short-term examination, not like adaptation program. Adaptation program will take time, but aptitude test only 2 days period it will be got over. But even it's a 2 days program, only a 2 days program, but we have to prepare very well for the aptitude test. So it's the theory, also criteria for assessing you as a competent nurse. There will be different, there will be changes every day. Actually, we can say that every day, how we attended it's different and now it's different. So it's really a difficult test, I can say that. But if we are confident and if we want to get it, so you can achieve that and you can be a registered nurse here in Ireland. So as I told, it's a 2-day test over a period of 1 week.
Yeah, just to explain, like 2-day test over a period of 1 week, in the sense, if you have your theory test being conducted on a Saturday or a Sunday, then the practical would be on the following weekend. So that means you have a week's time to prepare for your practical after the theory examination. So the benefit of aptitude test is here that you become a registered nurse in 2 weeks' time. You know, from one weekend to the other weekend, to say like in 10 days' time, you become a registered nurse. Whereas in adaptation program, you have to wait for weeks working in a hospital to get registered. So that's the main difference for adaptation and aptitude test.
So what is aptitude test? And it contains theory and practical session. So in the theory test, what we can see, what we expect in the theory test, like it will be multiple choice questions. All the questions will be multiple choice, and there will be 4 options are there. So you have to choose the correct option from that. And there will be 150 questions, and the timings will be 180 minutes. So you have to complete your theory test within 180 minutes.
Now, you should stay in the hall for minimum 60 minutes. So that's a set rule with the RCSI. So you cannot just walk away like after finishing the questions, or maybe you don't know the answers and you cannot just walk away. So you'll have to stay there for 60 minutes and you have to pass 50%. That means out of 150, 75 answers should be correct. And to say about the topics, all basic nursing topics will be questioned there, or it will be in the test, including nursing foundation, which we had learned during our first year nursing, med-surg nursing, elderly, psychiatry, community, research, etc. So that means you cannot just skip any topic just like that. You will have to know the basics of nursing.
So next one will be the practical scenarios. So what are the practical scenarios they want from you? And actually it's like 14 to 20 practical scenarios are there at present. And from that 14 to 20 practical scenarios, it will be combined, and you will be asking in one scenario, actually you will be asking 1 or 2 or 3 combined scenarios will be there. And in each session, for each sessions, you have 10 minutes only. So the time is very precious there, and you have to spend the 10 minutes wisely, confidently, and yeah. So 10 minutes only you have, so you need to practice it within that time frame. You need to complete the station. What they expect from you, they need to get it.
So the examiners will be having an expectation of what a candidate should be doing in each station. And as Ramya mentioned, saying 14 to 20 practical scenarios, you might get only 14. Sometimes by chance, you can get up to 20. So it depends on the day and the type of examiners who will be present. So the 10 minutes is effective use of time efficiently, I would say. And as mentioned in the theory, there you have to have only 50% pass. But guys, for the OSCE or the practical test, you have to pass all stations. Just remind in mind, you cannot just say, I was bad in one, but I did all the 19 very well. There's nothing like that. You will have to do all your practicals exactly, in an explicit way, I would say. And it includes skill performance, that's a nursing procedure, how you perform it, plus the documentation and communication. And to do all this, as Ramya mentioned, you will have to practice it. You will have to be confident, and you should have in mind what are you going to do about. And the examiners over there, to say the examiners itself will be acting or mimicking as patients. So you're not going to have any real patients. But let me saying that the examiners will act more than a patient.
Yeah.
The way they act
is very well.
Yeah, the way they act, you will get astonished from the way they act. They actually do very well. They express pain, they express agony, they express anxiety. All those will be done in a very magnificent way, where you wouldn't really understand, is she really a patient or an examiner? And in each station, there will be two examiners, one as a patient and one as an examiner as such. So the person who is sitting aside will be looking at you, observing you, seeing what you're doing, evaluating your documentation and communication as well. The examiner who is acting as a patient will be definitely looking at your face straight away to see your expressions, how confident you are, and the way you communicate. So most of us might have some mannerisms, we might show facial expressions, and if we go wrong, that can be seen on our faces as well. So just keep in mind, this will be seen by your examiner. And the way of evaluation differs from each examiner. When I attended my test, if I had examiner A for one of the session, and when Remia is attending the examination, it can be the examiner B for the same scenario. So the evaluation is going to be really subjective. So that means we should be capable enough to handle the situation in spite of whichever examiner is there. We should be confident enough to handle it.
And guys, one more thing to add. Here only you have two chances to attend aptitude test. That means in both of in theory and practical sessions, only you need two chances. So if you lost one chance, don't be worried, and you have another chance. But if you lose in both chances, then you are not going to work in Ireland as a registered nurse. You have to go back to your country. If you pass in first chance, then I can say that you are lucky.
Now, just to say now, what you might be thinking now, why should we go through this, or what is the need for it? What are these guys going to give us, and how are we going to help you? So being nurse, I would say when I came here for an aptitude test, I didn't have any help as such. I had to help myself, to find out the questions, the answers, and all that. So it was really a difficult time when the aptitude test just began. Like I attended the exam just soon after the exam was actually started by the RCI. So what we would like to do is we would like to help you guys to come in here and to work as a nurse in Ireland, because we know what is the quality of life here and what would be the changes in your life. So we would like you to have that. So being nurses in Ireland and through Hirehood Academy, what we are going to help you, the way we are going to help you are the following.
So we provide theory questions with answers. So there are a lot of theory questions and answers you have to go through. So we have all of those questions and answers. So we will provide you the theory questions with answers. And we are actually we have short time, so we don't have enough time to discuss each theory questions and answers. So you can go through that questions and answers. If you have any queries in that questions and answers, so you can contact any one of us. and we will clarify your doubts. And next one will be detailed discussion on practical scenarios over a period of 15 to 20 hours. So we have 15 to 20 hours in front of us. So in that short frame, we need to discuss all the practical scenarios, and we will demonstrate it, and we will give guidelines to you. But I can say that frankly, we cannot spoon feed you. So whatever we have the experiences, we get a lot of experiences from the Ireland and the healthcare settings in Ireland. So we will guide you, we will help you definitely.
Okay, just going back to the same points, like, so the theory questions which we provide will be having 4 options in it with the correct option. Saying that again, it should be the best option. You know, when you pick up the answer, there might be all 4 answers might be correct answers, but you have to pick the most apt answer among the 4. So we will provide you with questions and answers. And again, to add on to it, it is not 100% assured that all the questions should be the same while you attend the exam. So you will have to put something from your own part, which you had studied during your nursing education times. So some questions might deviate from the questions which we provide, but we have tried our maximum to collect as much as questions we could. Right from 2015, when RCSI has brought about this aptitude test, we have tried to collect the questions and answers which will be provided to you. And if you want a detailed explanation of it, you can go through your textbooks or Google it, and it's all going to be on your fingertips. And still, if you're not clarified, please, you can ask us and we will help you out as per our knowledge. And as she said, the practical scenarios are going to be through 15 to 20 hours. And you know, we will be having 14 to 20 stations. So in general, to say at an average, one station will be taking almost an hour's time to, to progress. And as you can see, we are the 2 instructors who will be providing the training, and we will divide the stations equally among ourselves, and we will let you know which stations we'll be providing the training on, and that will be carried on so and so.
Yeah, as she said, date and time for each session will be announced 2 weeks in advance. As we told, we are also working, so we need to arrange our roster as well. So according to that, we will provide you the timing and date and timings for each session 2 weeks advance. And please guys, please be noted that if you miss one sessions, then it won't be take again, because we don't have time to go for it again. So please make sure that if you are interested to participate in our online training program, so you need to set in your mind that you need to be present at the timings, at the correct timings, and on that correct date. So if you miss one stations, then as we told, you might get 20 stations altogether in your exam. So if you miss one stations, so you are not going to it will be tough for you. Yeah, it will be difficult for you when you attend that sessions, that scenario. So please make sure that be on time, and the time is very important. It's precious. As I told, in practical scenarios that we conducted by RCSI, they are more stick on the time.
And saying that again, just to add on to it, like, you don't feel that we are being too rude or mean, because there are so many candidates who might have been having their dates just in 2 weeks time or 3 weeks time forward. They have booked their aptitude test dates, so they'll be in a hurry to finish it off. So we can't just keep on lagging for those who have missed the sessions. So that's the reason why we don't want to go back repeating, but we will keep on going with what we have announced and how it has been planned. And the next would be equipments and articles which are used for the aptitude test. We will try to demonstrate as much as possible within the facilities available. So the dressing trays might be different, the temperature checking equipments might be different, the thermometers, and the sphygmomanometer might be different. So all that will be shown to you as per what the Irish healthcare facility practices.
And there will be a question and answer session after each session. So when we conduct our training program, that we will make sure that your questions and answers will be considered, and we will try our level best to address it, and yeah, definitely we can say that we will help you for that queries.
And finally, to add on, we would like also to let you know that we will be providing a free orientation, sorry again for the spelling mistake, and a refreshing program once you arrive in Ireland. So once you have prepared all through the online training program, and then you reach Ireland to attend your exam, just before attending your exam, either me or Remya or both of us together will be in front of you explaining what the situation at that moment is and what are the changes, if any. And if you have any doubts regarding any practical demonstrations, that will be clarified then and there when we meet you. So now, as there are so many agents and so many people helping around with recruitment and coming to Ireland and all that, so there's hundreds and hundreds of agencies we know who are doing this. So you will be thinking now, why should we select Hirehood? What is the reason? What special are you going to do for us? So we would like to say, like, first and foremost, we are not guaranteeing 100% pass. Okay, it's all up to you. We can only yes, we can only help and train you for the aptitude exam. The rest is up to you. So now, why Hirehood?
So we are conducting first online training for aptitude test. And as you guys, you never heard about aptitude test training online program. Is that correct? I hope so, because I didn't hear any aptitude online training conducted here in Ireland as well as in Kerala or any other country. So here we are introducing a online training program for aptitude test.
And just to add on to that, like there are centers who provide training for aptitude test. As via Keralites, we know there are centers in Kerala who provide aptitude test training. But then in order to get the training, you will have to take, you'll have to leave your job from wherever country you are, or you'll have to be on leave and attend the class. Now, but this session is going to be, as we told you, it's going to be online. And we will be letting you know in 2 weeks advance when and where the timings and what kind of session we are going to provide. So it's actually more flexible with your life and your job. So that would be the benefit of doing this training, I suppose. And we instructors have practically undergone the RCSI practical test, where I have heard that those who provide the trainings have got the information from the rest of the students, but they haven't gone through the practical test by themselves. But we can really say that we have undergone the practical test. So we really know what kind of anxiety and pressure you will be going through and how you can get rid of it as well. And working in Ireland, we know the health system here and the way of communicating here and all that. And we have been training candidates for aptitude tests for the past 3 years. So I have seen different students who have gone through these tests, and thanks to God, touch wood, everybody has passed the exam till this date. So again, saying that, I don't say that all of you are going to pass this test after attending our session, but that this is what has happened for the past 3 years.
So as we mentioned before, there are a lot of changes happening in the examination criteria, and each day they are changing the criteria. As I can say that because they know the students who are appearing exams, they are coming and they are underwent trainings in Kerala, or like direct training they have attended, and they were spoon feeding the students. So when they come here, if they commit a mistake, if one candidate commit a mistake, the following candidates doing same mistake. So it has been notified by RCSI and it has been mentioned there. So so guys, that's what, as I told before, and we cannot give any spoon feed. We cannot spoon feed you, and it is in your hand. As Janet mentioned, it is in your fingertips. So there are up-to-date changes are there. So we have been noticing all the changes. So we are getting the updates from RCSI as well. So we can let you know what are the changes are there, and we will be keep in touch with you till your examination. As we told, when you reach the Ireland, you will be provided a free online session from us, both of us, from any one of us, or both together. We can provide you a free session, so you will be free to act, free to ask any queries or any questions that coming to your mind.
Right. Just to, going back to the previous point there regarding the methods of communication, way of caring or nursing the Irish people. See, being nurses, we were nurses in India as well, so we know what was the method of communication over there. We are more oriented to the nursing care, or the job what we do, rather than communicating. But here, the people, they would prefer more to be communicated rather than providing the care. So you cannot just keep shut your mouth or just stand over there and finish off the job and leave the room or leave the people or leave the patient. They want you to be talking everything that's happening, well, around the world, maybe about themselves and everything. And probably most of them would like to have a chat about the climate here, the weather, the rain, the sun, and all that. So the method of talking to people over here is entirely different. You might be thinking like, oh, come on, what are you guys saying? They are all human beings, so what is so much of different? But then from our own experiences, we could say that, because we were also working with Indian patients, and when we came here, the situation was entirely different, where we had to act more on communication skills. So that will all be dealt during the training sessions. So the slide says what we really mean. So it's all up to you, your self-discipline, dedication, determination. You might find money and time to attend many other classes, but saying that this class is going to be very flexible according to your availability and your working timings, your family time, everything. We don't want anybody to sacrifice anything, but saying that for you to fulfill your dreams and come to Ireland and to work as a nurse, you have to put a dedication into it. And as Ramya mentioned several times now, there's no spoon feeding going to happen. It's just, sharing a knowledge regarding aptitude test, sharing our experience regarding aptitude test, and how to go through the situation. So all the effort should be from your side.
You can.
Yeah. So it's up to you. We will just cut off the T and we'll say that I can do it. So there's nothing impossible. There's nothing impossible in the world if you feel like you want to do it. So you can do it. And if you feel this session has been beneficial to you, and if you like to get signed in with the training sessions, please contact Hirehood International Academy in Kerala. And the phone numbers are also provided. WhatsApp number is also there down, email ID, and the website address. So you can communicate through any of these and come in touch with Hirehood officials and sign in yourself so that you will be able to attend the class. And if you felt that it wasn't really beneficial, please let us know that as well, so that we can improve in future, and we can also understand what your expectations are. So some guys might feel that it was just useless. So if that's the situation, please let us know. So because as mentioned earlier, it's a first online training, and we are also doing it online for the first time. We have provided one-to-one sessions, group sessions, straight in person, but not online. So if you feel that there is any, problem with it or it's not effective, please let us know. And if you're interested, please contact the officials so that they can help you how to get into it, and all the necessary details regarding the timings and the fee structure, everything will be discussed by the Hirehood officials. So we are the instructors who will be providing you the training and who will be saying what stations will be dealt each day and what timing they will be conducted at. So that's it really to say, not much. So I think we can bring you on all online so that you can have a sharing with us. If you have any queries, we can address it at this moment here. We have a few more time left. So we're just going to the questions panel. Few guys have mentioned your questions. Okay, or what is SREE's number? So hope you got the answer to it, because we have just shown the contact details now, so that will show you what is SREE's number and phone number, WhatsApp number, and the email, website, everything is mentioned here. Now, what kind of preparation we need to do? Yes, so that's what the preparation, what kind of preparation will be in detail explained to you through this 15 to 20 hour training sessions. Now, do I need to start studying NCLEX? No, guys, really, you need not have to do that much of NCLEX training, I suppose. If you have a basic nursing education, and while you were in your nursing colleges, if you had at least gone through few of your nursing textbooks, at least
fundamentals of nursing.
Yeah.
For example, yeah, that's the basic questions they are going to ask
you. And to say, if you have enough time in hand, no harm in going through NCLEX books. That will give you more knowledge, and it will make you more confident. So that's fine going through NCLEX books, but don't feel that it's going to be something like the questions are going to be something like an NCLEX question paper. No. And what's the fees? So Mr. Ravi has mentioned regarding the fees. So now telling that, you can contact Hirehood Academy and they will let you know regarding the fees. And Neeraj has again asked about the charges that will be mentioned to you. We should pass 14 stations out of 20 or all 20 stations. Right. So Roshni Matthew, just addressing your doubt. So the stations can be 14 to 20. So luckily, if you get 14, all good. But sometimes you might have to answer 20 stations. So it depends on the day, I suppose. And or else they might have 20 different situations which can be collaborated into 14 stations. So it's all up to the day how it goes. Whatever, so the number of stations is not the matter, but
number of stations will be 14. But in that 14, the scenarios will be combined and asked. So in one station, you might get 3 scenarios together. That's why I mentioned that the timing is very important, and within the 10 minutes period, you need to show the 3 procedures at a time within the 10 minutes. So we have 14 stations to attend, and you need to clear 14 stations.
So all the stations, all the stations, whatever the number be, you have to go through all the stations and pass all stations. So Neeraj Swami has asked regarding the flexibility to the timings. So saying that Mr. Sree Nair, the Hirehood official, will be providing you the timetable or what way it is going to be planned. So we will be letting you know 2 weeks in advance, as mentioned. So you will have, we think you will have time to go through, like, make it available yourself. And as said, if you go on missing it, sorry guys, we won't be able to repeat it. And what is the proposed Irish time? See, the timings will be flexible in the sense according to the country where you live. So we will be arranging the timings according to the UAE or the Gulf countries, Indian timings, and we have few people from South Africa, Maldives, all those countries, Philippines as well. So according to your country timing, the timings will be set. So don't worry about that. We will be available 24/7 providing training here. And what's the criteria of assessment in each station? So all that criteria regarding each station will be in detail discussed during the training sessions once you sign in. Okay, so Roshni has thanked us for it. This was a very helpful session. Thank you so much. Thank you, Victor. And I'd like to know when is the next session. Okay, so if you are interested in the training, you can contact Hirehood International Academy. Mr. Sree Nair, the phone number, email ID, WhatsApp number has been provided. And if you sign in, the next details will be provided to you accordingly. So this is a free webinar which we had conducted. It's just to make you people aware what is going to go happen. and what aptitude test is and all that. So if you feel it's good and it's going to be helpful to you, please move on. We would guarantee you that it's not going to be a waste of time anyway. It will help you in the future to attend the aptitude test.
If you consider those who regularly work straight shifts, it may be helpful.
Ms. Sheba Kunnel Philip has mentioned that if you consider those who regularly work straight shifts, it would be helpful. Could you please tell what did you mean like straight shifts? Because we are not used to that over here. So if you could clarify that, that would be helpful. And this was a good session to get an idea about aptitude test. Thank you so much. That was Rajita Soni. Thank you, Rajita, for your feedback. Worth watching it, Mr. Ravi. Thank you, Ravi. Thank you guys for your effort, Jinsi. One session will be for how many hours? Okay, that's a good question. Actually, one session can be at an average of 1 to 2 hours. 1 to 2 hours. So as we mentioned, 14 sessions, and the maximum number of hours that we are going to do it is 20, 15 to 20. In just to say in vaguely, we can say 15 to 20.
Also about the timings, to add on, actually someone asked about the timings will be flexible or not. Actually, the timings, the date will be provided 2 weeks prior. But sorry guys, I need to say that you need to set free according to the date and times whatever we are providing.
You need to be flexible.
You need to be flexible. Yeah. You need to arrange your duty.
We are being flexible, letting you know 2 weeks prior, because we will be taking off from our duty and our family life, and we will be setting time for you people to get trained. So please guys, be flexible with the timings. Vinoy Varghese has been asking about the materials for the aptitude test. Yes, obviously.
Go through rcsi.
Yeah, obviously we will be giving you the materials for theory and practicals.
But there are a lot of updates in rcsi site, so you can go through that and just get an idea about that.
So TC has said thank you so much for the valuable information. Thank you for your feedback, TC.
Thank you, TC.
And like 7 to 3. Okay, 7 to 3. Did she mean about this straight shift, I suppose? From 7 to 3. No, Sheba Kunnel.
Sheba, okay. Sheba Kunnel. 7 to 3. So Sheba, could you tell me which country you are on? So you are in Kerala, or you are in any other like Gulf countries?
Those can attend such classes only in evening times. Classes will be daily or weekly basis. Right. So at the moment, what we are planning is 1 to 2 classes. I mean, in a week.
Yeah.
That would be the way. 1 to 2 classes in a week. So to say, if it's 2-hour session, you will be getting 4 hours in a week, and so total 15 to 20 hours will be completed in a month's time. But saying that, if your exam date has been booked and you are in an urgent situation where you want it to be done, obviously we can help you out there. There's no written rules that it will be done through 1 month's time. According to your situation, we will deal with it. Jinsi has thanked Janet and Ramya. Very thankful to you as well for attending the session, and very helpful session. And thank you so much for your valuable time. Would like to know, is it good to join only after getting the decision letter? That would be a wise decision, I would say, because God knows what the decision letter is going to be like. So if your employer is insisting on adaptation program, then it's going to be waste of time and money. So better you get the decision letter and decide on either is it an adaptation program or an aptitude test, then you can go for the training. So that would be the wise situation. We don't want to grab you people into this.
Yeah.
We are just here to help you. Okay, so we don't want to misguide you either. Thank you guys from Neeraj. Thank you so much. Thank you so much. Now, if you guys want to, if timing is not flexible, I suggest Saturdays. Well, that will be according to the situation, because it will be according to the number of candidates who are going to sign in up with the academy and for the training, all that. So Shiva, if you are interested, please contact Mr. SREE NAIR and he will help you.
Thank you, Sri.
and he can let you know what, according to your flexibility and your timing, we can arrange the timetable according to it, hopefully. So just contact Mr. SREE NAIR and we can deal that. We will just try to keep you all speaking actually. So if you want to talk to us, can practice materials be downloadable or recordable? Practice materials, Mr. Ravi, are you talking about the practice OSCE sessions? If that's the situation, if you sign in for the training, we will be providing you the materials according to each station on that day. So suppose if we are dealing with station A, the materials for station A will be provided on that day, and we will be discussing about that. So I am not sure about the download facility and the recording facility of the webinar session, how it would be. We are just trying to make you people talk if you want to ask anything rather than asking questions through the text. Dashboard. Dashboard. Audio. No, just about dashboard. No.
That's ours.
Questions on the top, just about it. Sorry, we are actually
first time we are doing this seminar online, so
we are also just learning.
If there are no more questions.
Any more questions, guys? If you have no more questions, then we shall wind up. Just put the questions and see if anybody's asking any questions. If they are not, we'll just wind it up. Duration of course. So Sheba has again asked about the duration of course. So it's actually, as said, it's going to be throughout 15 to 20 hours, and it will be provided. Hold on, guys, just a minute. So it will be provided on a daily basis, in the sense like two hours each session carried out, and we would like to spread it through a month's period so that you get ample time to think on it, to demonstrate and to practice and all that. So some of them
actually we are muted, so we need to unmute.
Are we?
Yeah. So there will go to audio.
We are not. We are unmuted.
But it was muted. It was showing you are unmuted. Yeah. So there is go to audio.
No, we are actually on. It's just the rest of them, if they would like. Sorry, there are some questions coming. What is the criteria? Oh God. It expands. Criteria for evaluation for each session. So that will be mentioned while the training starts on. The fees, you can contact the Hirehood Academy and they will let you know the fees. Well, there's somebody asking whether they can attend the aptitude test training before receiving it, but as we mentioned, there's no point actually, because if you are suggested by the NMBI to attend the adaptation program, then you're just gonna lose your time and money. So we don't want to cheat you guys. As per the decision letter, you can just move on. If I enroll, so that's Lynn.
Yeah.
If I enroll for the review, can I occasionally send a personal message, chat, email to any instructors in case I need clarifications? Sorry, Lynn. Lynn is from Philippines. So, Lynn, you know, as you go into the training session, we will talk to you in detail about all that, because we cannot be giving more details unless otherwise you know sign in. Sorry. And Deepa Andrews. That means if I miss the class, any reason for me to review. So see, we are not being so mean or harsh with rules. If you have a reasonable reason, obviously we will try to help you because we are here to help you. So, you know, so it's not that we wouldn't give you anything, but we can't repeat the whole session as such for just one person. One session, how many hours, fees? Yeah, we have all addressed all that. Thank you.
Can practice material be flexible for use on
Okay, cutoff percentage to pass the exam. So as mentioned, Vinay Varghese was asking about the cutoff percentage to pass this exam. For the theory exam, 50%, practical exam, 100%. Right, so I think that's it. No more questions coming on. The last question came at 11:15, 11:16. Is it? It's 11:19 now.
Yeah. So it is in between it's showing. So anyway. So guys, we hope you don't have any more questions. So
thank you so much for attending the session. I think at least it has helped at least 50% of the group who has participated. Or we can see some have come and some have gone back and all that. So those who feel that it's good enough, please contact Mrs. SREE NAIR and get signed in with Hirehood International Academy, and the training will be provided to you. So thank you so much for your support. Being our first attempt, we really appreciate all you and your timing that you have spent for us and with us at this moment. So thank you guys.
We will meet some of them.
Yeah, hopefully we'll meet you for the training sessions in the future, and we'll all meet you as registered nurses in Ireland very soon. Thank you.
Guys.
Bye.
Thanks guys. See you soon.